Hello, everyone. Welcome to our webinar entitled The Adrenal Thyroid Connection, What's Your Body Trying to Tell You? Our guest speaker today is Dr. Aviva Romm. My name is Christine Stubbe, and I'm a medical education specialist at Genova's Asheville branch. I'm going to serve as the moderator for today's webinar. We would like to welcome Dr. Aviva Romm, referred to as the face of natural medicine in the 21st century by Prevention Magazine, one of the 100 Women to Watch in Wellness by Mind Body Green, and founding board member of Yale Integrative Medicine. Aviva Romm is a Yale-trained, board-certified MD, midwife, and herbalist with a specialty in women's health. Her new book, The Adrenal Thyroid Revolution, provides a groundbreaking blueprint to help women take back their health by understanding the root causes of imbalance.
Welcome to the Adrenal Thyroid Connection. And my goal today is to help you understand the adrenals and the thyroid. And when I use the word adrenal, I'm sort of using it as a catch-all term for the HPA axis. And what is really going on for women and what our bodies are trying to tell us in the epidemic of chronic disease that we're currently facing. So let's first talk about what's going on for women and why I use the term epidemic of overwhelm, because this is a really critical kind of central point in what I'm sharing today and in the work that I'm doing in general in my book and with my patients and in my teaching. So what we're seeing, and if you're in clinical practice or working with clients or patients in any capacity, you know, women are literally overwhelmed. It's such a common thing that women say, I'm overwhelmed, I can't handle it, I've got too much on my plate, I'm at the end of my rope, I'm busy all the time. But there's also a deeper level of overwhelm that's happening in that women are coming up with chronic disease symptoms en masse in a way that we have never seen before historically. So the obesity rates have skyrocketed, where by 20 and 30, 1 in 2 Americans is going to be either overweight or obese, and concomitantly with that, 1 in 3 is expected at least to have diabetes, and we're even seeing that trend shifting down into pediatrics, but it's especially impacting women. The rates of cardiovascular disease have gone up amongst women. The rates of cognitive dysfunction, dementia, have gone up amongst women. And significantly, women are, well, it's all significant, but interestingly and significantly, women are struggling with autoimmune diseases in unprecedented numbers and in a rate about 8 to 1 of men. So we know that women are, because of various factors in our hormonal life cycles, more susceptible to developing certain chronic disease, and particularly autoimmune disease. So in today's talk, what I'm going to show you is what's happening that I refer to as the epidemic of overwhelm, and why and how, quite literally, it's contributing to all of the chronic problems that we're seeing in women's health in our practices, and what you can do about it, for starters. So women are experiencing day-to-day emotional overwhelm, poor sleep problems. We know at least 47% of women say that in the past month they've lain awake at night, unable to sleep. Women are taking antidepressant medications at a rate of between 1 in 4 and 1 in 6. The rate of anti-anxiety medications matches that, and the rate of sleep medications is also very, very high. We know that women are facing autoimmune disease, as I mentioned, in unprecedented amounts. And just to give you an example, Hashimoto's, which is the most common of all autoimmune diseases, is impacting about, the impact on women is about 28 to 30 million women in the US have a known diagnosis, and probably about 50% more than that are not diagnosed but are carrying Hashimoto's symptoms without having any idea why. They're tired, gaining weight, their hair is falling out, they just don't feel well, they have aches and pains, and that's just one of many autoimmune diseases. We also know that for medical, political reasons, women are actually more likely to be dismissed for a lot of the symptoms that they're experiencing. So on average, it takes women about 5 years to get a proper diagnosis of an autoimmune disease, and astonishingly, 5,000 more women die a year in the hospital of heart attack than men, women who are already in the hospital, because women's symptoms are more likely to be dismissed as anxiety, stress, depression, or psychosomatic or hypochondriacal. So this is what a lot of women are hearing from their conventional doctors. Good news, your labs look great. Everything's normal. You're the picture of health. But when we look at this picture, what do we see that's going wrong here? Several things, right? First of all, the woman is clearly not doing well. She's covered in these maculopapular spots of some kind. And look what the doctor's doing. He's not looking at the woman at all. He's looking at the labs. And this is a big problem that's driving women away from conventional medicine to look for alternatives. They know they're not feeling well. They know something's wrong, and their doctors are not looking at them. They're not giving them the time of day. And this is a really big driver. But also, we know that physicians are just drastically underprepared, undertrained to treat the epidemic of chronic diseases that we're facing. We've been trained to treat acute infections, and we've been trained to basically treat with whatever we can write at the end of our prescription pad. I'm not going to go into that today. I talk about it quite extensively in my book and in articles on my website. But the power differential and the political reasons that women are being dismissed are also major contributory factors to this epidemic of overwhelm and the epidemic of chronic disease that women are facing, but also the tremendous need for practitioners to expand their understanding of what's really going on and to be really important major resources for women who are looking for alternatives in their care. So why are we all, not just women, experiencing this glut of chronic diseases that we're facing? Well, when I started to do a deep dive into what my own patients were experiencing and why was I seeing 22-year-olds already experiencing brain fog. In fact, I had one 22-year-old whose doctor told her, you know, apropos to the picture I just showed you, that it was a function of normal aging. She was 22, and I remember thinking, did he even look at her when she was sitting there? Did he look at her date of birth on the chart? How could he possibly say that? The women who were coming into my office in their 30s with metabolic syndrome, hypertension, and high cholesterol already. The number of women who were coming into my practice who maybe did have a diagnosis of Hashimoto's but had been thrown on a medication with no repeat labs and no medication adjustment, and even more the number of women who were struggling with symptoms of, for example, 30 pounds of weight gain in the last 3 months and had been told by their doctor if they had just ate less and exercised more, that wouldn't have happened, when in fact their exercise routines and diets had not changed at all, and they had Hashimoto's. Or the new moms who were told, oh, it's just a new baby, and maybe you just need to drink some fenugreek to increase your breast milk production, and that's why they were stressed, not sleeping, and not producing enough milk, when in fact they had postpartum thyroiditis. The struggle is real. Why are so many women obese? Why are so many women struggling with metabolic syndrome, diabetes, and dementia? So when I started to really dig deep, of course, as an integrative functional medicine doctor, I looked at all the root causes that I'm going to talk with you about today. But what I really started to dive down to was that there was actually a mother of all root causes, if you will, and that is cortisol disruption. And we're going to talk about that just in a second, but what I want to share with you is this idea that on an evolutionary basis and just on a human basis, biological basis, we are gorgeously designed to withstand quite a significant amount of stress. We are gorgeously designed with factors that keep us healthy and resilient. But we, to some extent, are like a piece of elastic, if you will allow me this analogy or metaphor. It's a visual. You know, if you stretch a piece of elastic and you let it go, it'll bounce back. And you can pretty much do that forever, right? Elastic will maintain elasticity for a very, very long period of time. If you stretch that elastic and hold it for too long, let's say you were to take that elastic and pin each end of it to a wooden board with 2 pins, but stretch that elastic to its maximum capacity and leave it like that for too long, that elastic would lose its elasticity. Similarly, if you stretch that elastic repeatedly beyond its capacity to stretch, you stretch it to its maximal stretch point, eventually that repeated stretch will also overcome the capacity of the elastic to rebound to its original position. Now, obviously, we're not elastic, but if you look at this picture that I'm showing you here on this image, what you see is a cheetah and some mammal that I'm going to call a gazelle in the African savanna. And what we know, and if you've ever watched the Nature Channel or been on safari, you've seen this yourself. The cheetah is in a fight or flight mode. It's in actually a fight mode. It's hungry. So its evolutionary response is saying, you need to get energy, you need to get food. So I'm going to activate your HPA axis and your sympatho-adrenomedullary axis, which is your epinephrine or adrenaline producing axis. You're going to go on the chase, buddy. You're going to go on the chase and you're going to catch you some dinner. And when you catch you some dinner, you're going to relax. You're going to, all that sympathetic overdrive that's gotten kicked in, it's going to go back to its resolution and you'll just be enjoying your dinner. Similarly, you've got these gazelles or mammals of some sort at the watering hole. Well, what happens when they are at the watering hole? They're just relaxed, they're having their hydration time, maybe they're, communicating with each other, and then they smell cheetah, and then they hear cheetah, and their back tenses up, their psoas muscle tenses up, their heart rate accelerates, the adrenaline sends glucose away from their core to their periphery so that they can run. If they were a fighting animal, maybe another cheetah, it would go into fight mode. But as a gazelle, it'll go into one of two modes, freeze or flight mode. They will typically go into flight mode. Rabbits, or sometimes that deer in the headlight phenomenon, that's called freeze mode. We usually talk about fight or flight, but there's fight, flight, or freeze. And human beings have that too. And if we start looking at different personality types to some extent, you can see that some people get scared and they sort of freeze under panic or sense of danger. Others will run and others will get their back up, literally, right? Your back literally gets up and you go into fight mode. What happens with these gazelles is that once they sense the danger, their ears will prick up, all these physiologic activities will kick in, they will run, the cheetahs will chase, the cheetah will catch the smallest, or youngest, the weakest, slowest, or most infirm of the gazelles. And what happens? The cheetahs, like I said, resolve their stress response. They have their dinner. But if you've ever watched the Nature Channel, the gazelles go right back to the watering hole or right back to their feeding behavior. Their stress response also resolves back to normal. Unfortunately, what's happening for us in our 24/7, super paced, constant exposure to information, stress, demands, and other forms of overload that I'm going to share with you, because they're not just psycho-emotional or lifestyle overload, we experience one of two phenomena. We either experience the phenomenon that is akin to taking that piece of elastic, stretching it out too far, and tacking it down to a board, right? You have this constant non-relenting or virtually non-relenting stress response activation. Or you experience the other form, which is the continual overextension of the elastic and release, another overextension of the elastic and release, and we're perpetually overextending and releasing. But the more we overextend, the more we are changing that dynamic elasticity and the ability to rebound. In physiologic terms, that ability to adapt to change is called allostasis. It's that ability to be elastic and rebound. Let me show you what's happening right here and why I determined that, and the next bunch of slides is going to show you why I determined that the imbalances in the adrenal stress axis, it should be, is a common denominator in the stress, is a common denominator in chronic disease. and even just chronic symptoms that women are experiencing. So what happens, what's actually going on in this stress response is very similar to what I just described for either the cheetah or the gazelle. But let's sort of focus on the gazelle for right now, because most of us feel more like we're being hunted than we're actually on the hunt. But if you think about the process of going to work every day, going for your paycheck. I once had someone describe, it was someone I know who did was actually teaching me traditional survival skills like making fire by friction and tanning and skinning animals, weird skills that I just happen to have that I learned long ago. And he said that most of us as modern people, instead of going from one hunt to the next, we're going from one paycheck to the next. So you actually can be stuck in that cheetah kind of role as a stress response. It tends to be a more dominator role. But most people are in that gazelle mode. You know, they're just feeling like they're constantly being chased by something. So what's happening is in your brain, you have two little tiny organs on either, or parts of your brain, I call them organs, but sections of your brain called the amygdala, which are called that because they're almond shaped. And their job is to act as a sensory surveillance system, both for your external environment and for your internal environment. They're the person on the street with the iPhone, as well as you're, watching what's going on. And they're also the person who is on, monitoring your internal physiology and your agitation, your anxiety, your stress, but also things that are causing you to feel like there's any kind of hazard or danger in your environment. So the amygdala picks up everything from the smell of smoke where there shouldn't be smoke to trigger that there's something wrong in the environment, to an internal reaction that you might have. For example, if you grew up in an abusive home or went off to war in Afghanistan and a sound or someone's facial expression triggered that memory of abuse. So it's part of where PTSD is formed. And it's working in conjunction with the hippocampus where memory is stored. So you've got this amygdala hippocampus dynamic going on where you're picking up danger, you're having an emotional reaction to it, but you're also having an internal warning system that sends a chemical message to your hypothalamus. Once that message reaches your hypothalamus, it sends out, so that the amygdala is kind of sending a 911 signal. The hypothalamus acts as sort of the 911 central office and says, uh-oh, we've got danger, and we need to dispatch. And the hypothalamus sends a signal to the pituitary. The pituitary makes the phone call to the adrenals, and the pituitary says to the adrenals, look, we don't know if this is a fire, a riot, or a life-threatening physical emergency. So it's the akin of sending out the fire department, the police department, and the ambulance service all at the same time. The fire department you can think of as cortisol, which is going to put out fires, inflammation. The police department you can think of as adrenaline to some extent, because it's creating some hypervigilance and some that more aggressive kind of control of your physiologic functions to make sure you can fight or run or resist. And the ambulance service is also a bit like cortisol in that the cortisol's role is also to make sure things like blood pressure stays elevated, which the adrenaline kicked into happening. But you want to make sure the blood pressure stays elevated, for example, in case you were to be injured, you don't want to bleed out and go into shock. It also mobilizes your immune system so that should you get injured, similarly, you don't get an overwhelming infection. So all these things are going on. At the same time, your liver is releasing glucose. You're having glycolysis. You're also breaking down fat stores to mobilize energy, to have the energy for fight or flight. Your brain is getting more blood flow because of that increased blood pressure and increased heart rate, which is giving you more oxygenation. You're also having the impact of both cortisol and adrenaline on the brain. Adrenaline's job is to make you hypervigilant. Cortisol's job, particularly over time, is to blunt frontal cortex functioning. So you're not really engaged in too much executive function. You're more reacting from a very primitive level because, if you have a danger to get away from, the last thing you want to start thinking about is calculating your taxes. That would distract you from being vigilant to the danger. So it actually changes the way you think. It even blunts your willpower so that you're not really making calculated choices. You're making primal, reactive, almost animal instinct choices. At the same time that your blood sugar is being elevated, your pancreas is also being called on to pump out more insulin so that when the danger is over, that excess blood sugar gets taken up into the cells and isn't a problem. This is all an incredibly beautiful, fantastic, amazing, life-saving reaction that has kept every single one of us intergenerationally alive for millennia. Unfortunately, this reaction, which was supposed to last for minutes to hours, in us is now being triggered multiple times a day, even sometimes during the night, depending on whether we ate the right foods in the evening or what we watched before bedtime, or whether we even were watching anything, because blue light inhibits your cortisol from going down, keeps your melatonin from going up. So you can be experiencing stress reaction 24 hours a day and not even fully be cognizant of it. So what is happening is that all these gorgeous systems that are supposed to protect us in the instant are starting to backfire. And I'm going to show you exactly how that shows up in different body systems. I want to just share with you, though, something I mentioned earlier, which is that the impacts of stress on our health are more than a feeling, which I think was a song in the 70s, right? But I'm not going to sing it. It's not just psycho-emotional stress, it's socioeconomic stress, but it's also food allergens that we're being exposed to through our diet. It's yeasts and molds, it's air pollution, it's pollution in our food, it's sugar and junk food causing chronic inflammation and blood sugar imbalances, it's chemicals are an environment, it's our sedentary lifestyles, it's all the factors that contribute to systemic overwhelm. So if you think about it this way, it's not just our stress response that's being overwhelmed by being, in high demand 24/7 from our jobs, our families, our economic expectations, etc. If you think about your detoxification system, we have not evolved to manage and detoxify, metabolize, detoxify, and eliminate the 80,000 chemicals that have appeared in our environment since the 1950s and the Better Living Through Chemistry movement or campaign. Prior to that, we did not have a host of environmental chemicals. We had phytochemicals, phenols, and minute amounts of toxins in our foods that we were programmed and biologically evolved to eliminate, but not what we're being exposed to. So our detoxification systems are being overburdened at the same time that our diets have become depleted of the very nutrients that we need to maximize detoxification. So Americans are getting 10% of their fruits and vegetables that they need a day. And I'll tell you, I'm seeing that in people who are trying to be healthy and eating a paleo diet. They're still getting a minimal amount of the vegetables and fruits that they need to support detoxification. Another example, which you'll, I'm sure, relate to, is the impact of overwhelm on our gut. Our gut microbiome is incredibly dynamic and flexible to the point where a pathogenic species can become beneficial in certain settings. If your diet is healthy and for some reason a beneficial species took a hit, a pathogenic species can actually change. There are amazing things that are happening in the gut beyond what we're just even beginning to tap now. But we were not evolutionarily prepared for the fact that by the time American children are 18 years old, they have had a 20-round antibiotic exposure, right? 30% of babies are being born in the United States, more than 30% actually, already with an antibiotic exposure before birth because mom had a C-section. C-section rate in the United States is on average 34%. Every woman in the United States gets an antibiotic IV exposure at the time of C-section. You add to that the 30 or so % of women, and there's some crossover of women who get treated for group B strep with several rounds of doses of antibiotics in labor. Then the average child has already had several rounds by the time they're 2 for otitis or ear infection. Then we get another 10 rounds on average by the time we're 20 and 30. So our gut was not prepared to respond to that kind of overwhelm. Add to that food intolerances from changes in the way we grow our food. Add to that artificial sweeteners, which knock out the gut microbiome. And I could spend the rest of the hour just talking about things that take out the gut. So when we're thinking about HPA axis triggers, those are big ones. Also, anything that causes inflammation activates the HPA axis because its job is to produce cortisol to put out inflammation. So let's look at what's happening. And before we do that, I want to share kind of an accidental term that I ended up coining in my practice called SOS, or Survival Overdrive Syndrome. What was happening is two things. One, so many of my patients were coming in telling me they were in overwhelm. They were in overdrive. This was the words they were using. You know, I'm tired and wired. I can't fall asleep tonight. And so I started talking with my patients about how that's part of their survival drive and how their survival drive was in overdrive. And so I was sharing this with someone one day, and she said, it sounds like survival overdrive syndrome is exactly what you're talking about. I think you should call it that from now on, Aviva. And I said, you know, it's exactly what it is. And so I started sharing that with my patients. And then it evolved to really me thinking about this as a core philosophy of what is going on. But I also really loved the term SOS, because SOS is a call for help. It's a distress signal. And when we are thinking about symptoms and what's going on in a woman's body, we want to really think about this as every symptom is a call for help. And if you were a rescue pilot and you saw SOS on the beach, as I show you here in this picture, you wouldn't think, oh my God, what's wrong with those people? They should have picked a better boat. They should have done this better. They should have been more prepared. They should have not gotten into that situation in the first place, right? You would respond with compassion and your helper mode would go into play, and you'd want to figure out what you can do to help those people. And I share that with my women patients because a lot of them, particularly if they're dealing with such significant exhaustion from adrenal inhibition, or if they're dealing with just chronic Hashimoto's that isn't well controlled and they're tired and they can't keep up with their life. Sometimes they can't even play with their kids. Women are apt to beat themselves up for it. What am I doing wrong? I should have done this better. I should be eating better. And I really try to enlist a woman's self-care and self-compassion. And I think that's really important for us when we're also making plans for our clients and our patients, because plans can also be very overwhelming. So keep that in mind. What's really going on at the heart of so much of what is happening physiologically is survival. The survival response system, the HPA axis, is getting kicked into overdrive. We're seeing symptoms as a result, and we want to respond to those symptoms with understanding and compassion. Another thing that's really important to keep in mind as we go forward is that when you have the survival system activated, at first what you're experiencing, and this can be going on for weeks or months, is increased production of cortisol and increased production of adrenaline. But over time, what starts to happen is the misnomer of what we call adrenal fatigue. First of all, there's no such medical creature, but second of all, the adrenals are actually not getting fatigued. What's happening is that cortisol, which is also called the wear and tear hormone, even in endocrinology conventionally, it's known as the wear and tear hormone, because over time what's happening is that chronic exposure to cortisol causes increased bone turnover. It causes breakdown of muscle, as I mentioned. There is breakdown of fat. There can also be breakdown of muscle, and we'll talk a little more about this. The brain says, we can't let this happen endlessly because this person is going to go into major breakdown and disrepair. So the hypothalamus actually blunts the messages going to the adrenals. It's the hypothalamus and the pituitary that are saying enough is enough, and actually tell the adrenals to down-regulate the production of both cortisol and adrenaline to start to protect the organism from overwhelm. And that's where you start to see the symptoms of what we call adrenal fatigue, where you see the exhaustion end of the spectrum of things. So here's what's happening, and I'm going to kind of give you a rundown in a nutshell, because I want to make sure we have time for what you can do and for questions and answers. In a nutshell, cortisol is supposed to have a diurnal rhythm. It's supposed to be high in the morning, start to decrescendo through the day, and hit its nadir roundabout when we're entering into a nice first deep sleep cycle. Around midnight, around 2 in the morning, it starts to pick back up again. When cortisol is dysregulated, a number of things can happen. If it's too high at night, it's too high in the evening, as I mentioned, not only does it keep you awake, because cortisol has a stimulating effect, much like anyone you know who's ever taken a steroid, they can feel really jacked. I mean, steroids can actually cause not only depression, but mania. And one of the things that cortisol can do is cause you to feel really wired. Cortisol also inhibits melatonin. So when you have high evening cortisol, you have trouble falling asleep. And then if you do fall asleep, your melatonin can be dysregulated, so it's not reaching its maximal level. So you don't have good nighttime sleep, and you don't wake refreshed. Part of why you also don't wake refreshed is because one of melatonin's major jobs, and if you treat women with breast health problems or breast cancer, you know that we don't only use melatonin for sleep. We use melatonin for detoxification, and for particularly estrogen detoxification. So you're also not getting good detoxification overnight, and that can lead to also that feeling of grogginess or achiness in the morning, or just not feeling well. The other thing that should happen is cortisol starts to pick up during the night, so that it's again reaching its peak in the morning. If you're not getting good cortisol elevation in the morning, you have something called a blunted cortisol awakening response, or CAR. I think about it as like your car. It helps you go somewhere. If you're not getting a good cortisol awakening response, you're not going to really want to get up and get out of bed in the morning. And the impact on this is feeling like you're still tired, even if you have gotten a good night's sleep. So sleep impact is huge for women, and we can tie it right back to cortisol imbalances. Another thing that happens if you're not getting good sleep is that it affects your cravings the next day. You want more sugar, you want more caffeine. Women who are not getting good sleep at night can on average expect to weigh at least 5 more pounds. A new study just came out showing that even a minimal amount of sleep disruption can lead to depression. And in addition, we know from studies done on women who have nursing shifts at night, they have higher rates of breast cancer, again, likely due to this lack of detoxification, particularly estrogen detoxification. Cortisol has stimulating effects on cell growth. It also has an impact on growth factors. And there was one other thing I was going to tell you about nighttime awakening. Oh, it changes how your immune system is functioning. So circadian rhythms are not just a random sort of, it's better to sleep at night and be up during the day. We actually have different cellular responses at different times of day to cortisol. The way I think of it is the hypothalamus is sort of like the conductor of the orchestra. Every cell in your body is like a musician in the orchestra, and cortisol is the sheet music, telling which musician to play what note at what different time of day. So we have different immune activity going on at night when we're sleeping and resting than we have during the day when we're more likely to be exposed to a variety of organisms in our environment. And cortisol is that messenger. Cortisol is telling each different cell in your body when it's time to do what it's supposed to do. And so when you're not getting good sleep at night and that circadian rhythm is disrupted, the entire messaging of cortisol to each and every cell takes a hit. So one of the first things I always do in my practice, and we'll talk more about this in a little bit, is work with cortisol, circadian rhythm reset, and sleep. If you're not getting good sleep, everything else you can maybe for not. As I mentioned, 2 things already. When you have a flow of adrenaline or constant exposure to adrenaline, it causes hypervigilance. This helps us to be more aware of danger in our environment. But hypervigilance that doesn't turn off becomes anxiety. Hypervigilant, when somebody's anxious, what are they? They're hypervigilant to their environment, and then they're worried about what they're experiencing in their environment. So they're having an emotional reaction to the hypervigilance. Over time, when the brain tells the adrenals to stop producing so much adrenaline, you actually start to have the reverse impact. You have a decrease in focus, a decrease in attention, but you also have a decrease in motivation and desire to accomplish things. So you can become amotivational, because one of the things that adrenaline does is it gives us that desire to fight or flee, right? If you think about that in terms of motivation, that's really where that motivational force is coming from. Similarly, cortisol can cause anxiety, and over or chronic exposure to cortisol, as well as cortisol inhibition, can both cause depression. So whenever I have a patient who's experiencing anxiety and depression, I don't want to just throw on the 5-HTP or throw on the Lavella or whatever it is. Those things are all really important. But seeing what's going on in the HPA axis, in the SAM axis, both super, super important, and can help you turn this around without ever having to reach for St. John's wort or GABA or any of our other supplements, but those can be a great adjunct too. So as I mentioned earlier, when we're under the impact of cortisol, it causes us to utilize quite a bit of sugar, but it can also cause us to deplete fat and crave more fat and sugar. It also causes us to crave salt, because what is our body doing under stress? It's trying to maintain blood pressure because of the reasons I mentioned: more blood flow to the brain, more blood flow to the periphery, and preventing you from going into shock if you get injured. So when we think about salt, sugar, and fat cravings, yes, we want to think about what's going on in the gut. We want to think about all the manipulations and gyrations that the food industry is going through, and we want to think about core nutrients. But we also want to think about what's going on in the HPA axis, because it can cause us to crave fat, sugar, and salt. Cortisol also is the primary hormone responsible for causing you to pack weight on around your middle. And we know that that visceral abdominal tissue, that fat around the middle, that belly fat, is not just benign muffin tops and flubber. It's actually inflammatory producing cells that are sending chemical messages to the brain that impact hunger and satiety. And also, the more sugar we crave and eat, the more we eat sugar, the more we pack fat around our middle, that fat also sends down-regulating messages to cortisol releasing hormones. So it's actually blunting the stress response. So it's actually causing some self-soothing of stress. So we are literally self-medicating with sugar and carbs to calm down that stressful feeling, which if any of you have been stressed and stress-eaten, you know has a huge, you gotta get that immediate sense of and relief. So whenever I have a patient who is struggling with cravings, I'm always looking at what's going on in the stress impact. And also, as I mentioned, poor sleep can lead to sugar cravings and carb cravings. And cortisol not only makes us pack on weight, but it makes it harder to lose, because as I said, it's actually changing your leptin and ghrelin signaling. So you start to lose a sense of when you're hungry and when you're full. And so you want to think about that whenever somebody has confused messages around their feeding. Also, you want to think about that with folks who are struggling with anorexia and bulimia, particularly anorexia, because these studies have shown that cortisol messaging is altered in those eating disorders. Mind and willpower. So I mentioned several things that happen already, so I just want to touch on them briefly. But the impact of adrenaline is to create a hypervigilant state, not a let's calculate algebra state. So you start to actually have long-term impact on your executive function. cortisol actually changes neural wiring and neural signaling in the frontal cortex so that you have less focus and less attention, but also less willpower. So your patient who's saying, I keep trying to diet and I'm not ever able to stick with it, and they're beating themselves up for having bad willpower, explain to them why it's happening. They will probably start crying, or you will see their shoulders drop when they realize it's not them. It's a societal, cultural phenomenon that is happening, and that's something they can actually start to take control of by altering their lifestyle, altering their diet, and using the supportive supplements we're going to talk about. Over time, this impact on mind can lead to brain fog, poor concentration, poor memory, and it is actually a potential harbinger of dementia later on, not to mention the chronic inflammation that's going on at the same time. And one of the things I didn't mention with weight is because this system is causing your body to release not only blood sugar to keep you able to fight and flight, but also insulin, you can actually start to wear down your pancreas's motivation to produce insulin, and your body develops peripheral insulin resistance. So this HPA axis alteration and cortisol are core in the evolution of metabolic syndrome in modern times. Immune impact. I mentioned that when cortisol gets mobilized, when this HPA axis gets mobilized, so does your immune system. You have demarginalization of white blood cells. You have activation of anti-inflammatory mediators as well as inflammatory mediators, because your body doesn't know what the danger is going to be and what it needs to do to respond. So you get cascade activation of the immune system. In the short run, that can be a really great thing because a little bit of a primed immune system is highly responsive. But over time, your body starts to protect you from overactivation of your immune system, and you can start to have down regulation of immune reactivity. So you get sick much more often. It's your patient who's struggling with chronic colds and infections that always turn into bronchitis and pneumonia. It's the woman who's getting recurrent yeast infections, even though you've done everything with her gut, or she's getting recurrent UTIs. Or it's the person who never gets sick until the first day of their vacation and then completely crashes. Or it's the person who develops an autoimmune disease once they've crossed over from that adrenal overdrive into that adrenal cortisol inhibition that can happen from the brain saying enough is enough. The gut gets altered because when two things really primarily happen. When you get mobilization of blood flow to your periphery to help you fight or flee, that blood flow is going away from your gut lining, and it can actually cause actual damage to the gut lining. We also know that the impact of even short-term stress, a day or an hour of stress, changes your microbiome. And over time, long-term stress, meaning weeks to months, can have a major detrimental impact on the microbiome. So again, we want to think about, for our patients who have IBS, IBD, any impact on their bowels, SIBO, yeast overgrowth, really anything. We always want to think about what's going on in the stress response system. Constipation, diarrhea, you can all tie it back to what's going on with cortisol and adrenaline. Cardiovascular impact. That chronically stimulated adrenaline and chronically stimulated cortisol can lead to chronically constricted blood vessels, hypertension. That high blood pressure can become chronic hypertension, but also that impact can lead to cardiac arrhythmias over time. And then you've got the secondary impact of the increased weight and metabolic syndrome on the heart. So major impact on cardiovascular. We also know, interestingly, as an aside, that loneliness is a major trigger for cardiovascular disease. And the InterHeart study, which looked at over 11,000 individuals, found that loneliness had more of an impact on was more predictive of heart disease than diabetes, hypertension, and smoking combined. And where is it coming from? Dysregulation in the HPA axis. Hormones and reproductive impact. When you are under chronic stress, your body is getting the message that this is not the best time to be expending resources on reproduction. CRH and ACTH Both have inhibitory effects on the gonads in men and women, in fact, and inhibit reproduction. They can also lead to premature ovarian failure. The combination of metabolic syndrome and hormone dysregulation is also a big contributing factor in PCOS. Memory and cognitive function, I kind of already touched on in mind and willpower. Inflammaging is a phenomenon where we actually experience the ravages of aging, but also at a much younger age. Now, our culture teaches us that aging is a natural phenomenon, but getting old is just sort of a fact of life. And it's not. We do not have to end up, with a million wrinkles, maybe unless you live in the Southwest and spend a lot of time outside. We do not need to end up with osteoporosis, dementia, heart disease. And the average woman in America, 50% of women in America over the age of 50 are already on 2 medications. One of them is almost always a statin drug. So cortisol has a massive impact on how we age because, as I mentioned, it's the wear and tear hormone. And along with that, there's the phenomenon of brain inflammaging, the impact of cortisol on the brain, as I've talked about. And finally, I want to mention before I jump into some of the things that we can start to do, and I apologize, we're going to kind of cut into question time a little bit because this is really a 1-hour talk, is the impact of cortisol and HPA axis dysregulation on the adrenals. And I'm on the thyroid, and thyroid problems, as I mentioned earlier, at least 30 million women are impacted by hypothyroidism. 90% of all thyroid problems in the United States are hypothyroidism, and about 90% of hypothyroidism is Hashimoto's, and about 90% of all people impacted are women. So it's quite simple what's happening, really, when you look at it sort of biochemically. Corticotropin releasing hormone, CRH, which is coming from the hypothalamus, is actually directly inhibiting TSH from reaching the thyroid, which is represented by that sort of bow tie shape here in this image. So you're getting direct inhibition of thyroid stimulation by TSH, and then cortisol production is directly inhibiting conversion of T4 to T3. So you've got a 2-hit impact at 2 different points in the stress response system in the HPA axis: corticotropin releasing hormone inhibition of TSH, cortisol release inhibiting T4, T3. And I call this the reserve theory. What your body is trying to do is conserve or reserve energy. And so what's happening is your body is perceiving that this is a time of high stress, high energy demand, and we cannot be metabolically expending energy that we don't need. So if you're in an energy crisis, right, if we are in a gas or oil crisis, what do? We turn down our thermostats and we learn to get comfortable at a lower temperature. And that's exactly what's happening in the body. The brain is saying, we don't have extra resources, so we're going to actually dial back on the thermostat. What's the thermostat of your body? It's your thyroid. So I'm not going to go all into thyroid physiology and pathophysiology, but that is the intersection of the adrenal and thyroid connection, and it gives us clues to what we're going to do for healing. So what can we do for women? Well, the first thing is to heal the root cause of overwhelm, and we want to look at where is that overwhelm happening. Is it happening in the diet through food triggers, food intolerances that are overwhelming the body with inflammation, that are overwhelming the body by creating leaky gut, and that leaky gut is then causing autoimmune disease in a downstream effect, along with the inflammation that is chronically triggering the adrenal stress response system. It's chronically triggering cortisol production. So what is the first thing I do? I do what I call a dietary reboot. When your computer is on overwhelm, right? Too many systems are open and it goes into a spin. The only thing you can do is shut down and reboot, right? You want to clear the information overload. Food is information. How do I clear that information overload? A food reboot. We say, let's shut it down and let's restart. So we clear out anything that can be contributing unhelpful information to the system. When it comes to inflammation, we want to think of the things that we usually turn to: gluten, casein or dairy in general. Food toxins coming from herbicides and pesticides, which also have a direct impact on the thyroid. Anything, sugar that's causing inflammation, artificial sweeteners, anything that could be causing excess information that the body can't handle, that's overwhelming the body's ability to deal with it. And then, of course, within that, we want to think about, is the person getting the adequate nutrition they need? Because on an evolutionary basis, we were getting a lot of information that was helpful and healing from our diets that we're not getting anymore. So we want to make sure we're repleting the diet, not just removing, but also repleting. And then we want to think of blood sugar balance, because one of the things that sends your brain into DEFCON 3 is lack of adequate blood sugar. So remember, I said the amygdala is receiving information both from the external signals, but also the internal signals of danger that our environment and our internal environment are producing. One of the primitive danger signals that we are most primed to deal with is famine. When people are skipping meals, which women are doing all the time, and experiencing blood sugar imbalances, they tend to go into that DEFCON 3. The HPA axis gets triggered. So we want to teach women to keep their blood sugar really regulated. And I have a whole program for that in my book, In the Adrenal Thyroid Revolution. We want to address stress and circadian rhythm disruption. So anything we can do to teach women mindfulness exercises, mind-body regulation, and self-care. Women are notorious. The way we say men are bad at asking for directions, women are as bad or worse in reality for taking time for self-care. But we have to be able to dial back that overactive stress response. And if they've gone into adrenal inhibition, cortisol production inhibition, we need to give the body messages that everything is safe by calming the body down, replenishing and nourishing. And circadian rhythm repair can be done really by having women wake up at the same time every day, go to sleep at the same time every night, hit the pause button at 10 or 11 o'clock in the morning, and again about 3 or 4 o'clock in the afternoon, even if just for 15 minutes, to just take some time to decompress and heal. And I talk about circadian rhythm repair in my book, and I even have a whole separate blog on it over at my website at avivaromm.com, so you can read a whole plan for circadian rhythm repair. We have to heal the gut imbalances that can happen as a result of the stress response being in overdrive, but it's bidirectional. Disruption in the stress response creates in the gut creates information and inflammation that's activating the HPA axis. So we want to both heal the stress response and heal the gut at the same time, so we can calm down that inflammatory messaging that's going from the gut to the brain. Also, the microbiome is actually sending messages. It's sending chemical messages that go through the vagus nerve to the neural system that send messages to the brain. So when you're having microbiome disruption, one of the reasons that we can get anxiety as a result of microbiome disruption and why using probiotics can help reduce anxiety is it's calming down those unhealthy chemical messages that are coming from pathogenic bacteria that are triggering HPA axis response, that are then causing a relay that creates a rise in adrenaline and cortisol that cause anxiety. Now, stealth infection can create a chronic demand on the body for cortisol. And so when I'm talking about stealth infection, most classically, I'm talking about EBV. So you want to make sure that you're checking for infection, and then you want to reduce the body burden of environmental toxins if need be, and certainly support detoxification, which is done with diet, reducing toxic environmental exposures, and using supplements like NAC and DIM and indole 3-carbinol that all support the detoxification process. We want to support healing. So I mentioned this idea of resilience in the beginning, that we are really primed to have great resilience. We want to help a woman restore her resilience and build her reserves. and replenish and not push further. So these are often women who are already feeling emotionally and psychologically overwhelmed and exhausted. So baby steps and pacing of a plan, teaching women self-advocacy to be able to do self-care, and remember to heal not just the body, but also give them a plan that can help them restore balance in their life, and give them practical tools to keep it simple. KISS is keep it simple, sister. So helping them with everything from meal planning to how to get extra support in their lives, help for their kids. This is all part of helping them to heal their HPA axis. You want to make sure that you can help identify allostatic load. So looking at cortisol production, and I usually use 24-hour cortisol testing. But here are some, in this slide, I'm not going to go over all the details here, but these are the parameters that were found in the MacArthur study on aging. It was a longitudinal study looking at a large amount of people to identify what are the mediators that we're looking for when someone is in SOS or has allostatic load. Think of allostatic load as that camel I showed you in the beginning. And allostatic load is the straw that breaks the camel's back. It's when we exceed our capacity to stretch that elastic and have that elastic rebound. So these are the parameters that I check in my practice. And you don't actually have to do a waist to hip ratio. You can just do a waist circumference. Anything over 35 inches for a woman actually shows that she is in allostatic load. She has too much belly fat, and it's a predictor for heart disease, diabetes, dementia, and inflammaging. You can look at the blood pressure. Is it chronically elevated? I don't always look at albumin, but I do always look at total cholesterol and LDL. And I do look at fibrinogen and highly sensitive CRP as markers of inflammation. Here's a quick example of a 24-hour salivary cortisol, and this is sort of the classic SOS pattern of someone who's in overdrive. You can see that kind of gray zone in the middle and that yellowish zone extending beyond it are very normal, and then sort of where you can extend normal for individual variation. This is an example of someone who is not getting a good cortisol awakening response, but as you can see, instead of going down through the day, their cortisol is actually going up, and they're having these peaks, and then it's staying up at the time that they should be asleep. So classically what you see in this pattern, which is one of many that I teach about when I do my 6-hour training on cortisol, on adrenal and thyroid imbalances, is that this person is probably feeling pretty depressed and pretty tired in the morning, maybe even anxious and anxiety waking them up around 5 in the morning, and then probably feeling unable to sleep at night and pretty agitated throughout the day. I'm not going to go into the thyroid patterns that we see here. Again, that's something I do in my 6-hour training. But what you can see here are the tests that you really want to make sure that you're looking at when someone is getting a comprehensive thyroid panel, not just the normal typical TSH that conventional doctors do. And then what can we do to help support women? Well, all of the lifestyle things that I talked about are really important. The circadian reset, blood sugar balancing, and I talk about that as part of the circadian reset. One of the things that we're seeing a lot of women do is go onto very low carbohydrate diets. Here's an interesting thing about that. Studies done in women show that women who are actually carb restricting have more cortisol imbalances, and women who carb restrict, particularly at dinner, tend to have higher nighttime cortisol and more sleep problems and higher weight. So we want to make sure that we're teaching women not just to balance their blood sugar with fats and protein, as so many diets are promoting nowadays, but also to make sure women are getting some form of a healthy complex carbohydrate, so grain or starches, and if they can't tolerate grain because of other things that you're treating, at least some good quality starches like resistant starches from white potatoes or that have been cooled to room temperature, or preferably high energy, high nutrition packing sweet potatoes and winter squashes. And similarly at dinner, I actually include 2 servings of complex carb or a complex carb and an energy starch at dinner to make sure that they're getting that within 5 hours of going to bed. And then finally, we want to think about adaptogens and other HPA support. So adaptogens are a class of herbs that actually have been shown in, there's, thousands of studies on adaptogens looking at in vitro, animal, and human clinical trials, which is a separate talk that I give, looking at how they can be used to reset ACTH in the brain. So when you're resetting that brain, telling the adrenals not to produce as much cortisol, as well as help regulate excess production of cortisol, but also can be involved in healing in all of the downstream impact that we see from HPA axis dysregulation and SAM dysregulation. So, for example, adaptogens have been shown to regulate blood sugar, regulate blood pressure, improve fertility, improve immunity, improve autoimmune disease, and on and on and on. So they can be useful in the core dysregulation, as well as healing the impact that we see in the organ systems.
Hi, Dr. Romm. I'm going to have to interrupt here. We have a hard stop right at 1.
Okay, no worries.
Yeah, so
I'll move to the end, and so people can see how to find out more and study with me more.
Okay, great.
So yeah, just in brief, if you want to learn more, it's actually not too late to jump onto a course that is just in the, is ending right now, but you can still access the replay of this course. If you want to do that, email me at aviva@avivarom.com, because the only way into that course right now is through private back-end access of letting me know you want it. And that course will only be available until September. Well, actually till August, and then a new program will be starting, which is going to be the only training program on functional medicine for women, and it's the New Medicine for Women Institute. So you can find out more by following me over at avivarom.com.
Wonderful. Thank you so much, Dr. Romm. That was a great presentation. We did receive a lot of positive feedback and questions, but unfortunately we're not going to have time to get to those questions today. And so,
is there a way, do you want to send me the questions or direct people over to me, and I'm happy to do my best to answer them?
So you just gave your email address?
Yep.
Okay. If you're open to that, that's fine.
Yeah, just put Genova in your subject line and put questions, and I'll know it's coming from this talk. And I apologize, it was actually designed as an hour talk, so then I realized the Q&A after.
Right, that's okay. I just want to direct everyone to our website, www.gdx.net, for additional educational materials. You can see the phone numbers on the screen here for client services if you had additional questions. And then I also wanted to mention that we have a webinar next week or next month with Melanie Dorian speaking on HPA axis dysfunction and obesity. We also have Genova's first CME accredited event where you can receive 4 CME credits. This is a symposium on the microbiome and involves a full day of learning about the microbiome with keynote speaker Dr. Todd Lapine. The one coming up is going to be held in San Francisco. We already hosted the symposium in Boston and Chicago last month. And all attendees of this webinar today will receive $100 off registration using the promo code MES100. You can find those registration details on our website, www.gdx.net. Thanks again, Dr. Romm, for a great presentation.
Thank you for having me.
Yeah, thanks everyone for being here today. Have a good one.